I remember being in a staff meeting before the pandemic broke out, literally days before our first case in Michigan. And I remember raising my hand to say to my peers, Black, Latino, Native American folks are going to die from this virus at a disproportionate rate. And no one seemed surprised by that, right? Not that they were callous in any sense, but it's a story. It is a trend we have seen in virtually every health condition that we combat as healthcare providers. And when the vaccine rolled out, I was expecting to have this huge sigh of relief, and I didn't. In fact, that fear swelled up again. And I immediately said, oh no, I can't get this vaccine. This is not for me. And I imagine a lot of other people felt that way when they heard about the vaccine. I didn't know if the politics of the country had impacted the testing and the science behind the vaccine. I didn't know how many African Americans and other underrepresented groups or high-risk groups, people of color, had been included in the vaccine. I didn't understand the technology. I didn't really understand what it was supposed to do. So I think I didn't have a lot of messaging to prepare for when the vaccine was ready. And so I didn't have information. And ultimately, I think that that was the source of my fear, the unknown yet again. So I'm still discovering the many reasons that people are hesitant about vaccines. And what I found is that for each individual, those reasons are valid. So I think not only is it, people don't have enough information or perhaps they have misinformation, but there may be a lack of trust. There may be a lack of trust in the system. There may be a lack of trust in the process because healthcare hasn't always shown up trustworthy. People get paralyzed about making a decision when it's so much noise and unknown is a part of the chaos. And it's like you gotta kind of dissect some of that because sometimes you don't know why you're terrified. You just are, and then you have to get these little stories and get this information to help resolve some of that internal disconnection. It's just not all coming together just yet. And so I think that's what I had to go through as well. My ultimate goal in being here today is to show that even I, as a clinician, have experienced what a lot of people are feeling. And I get it. We hear you. We see you. And ultimately, I love you and I value you and I want you to be well and I want this world to be back to its greatness. And so this opportunity for a vaccine right now is our best chance at getting there.